blood transfusion in Lagos University Teaching Hospital, also known as LUTH Lagos, and she's going to be discussing this topic in depth. As you know, this is surviving sickle cell. We're going to be talking about specifically the management, comprehensive management of sickle cell disorder. So as always, if you have any questions and things like that concerning this topic, you can call us at 0700 923 923 923, or you can send us a message at 0817 313 6193. You're welcome, Dr. Otokiti. Did I get it right?
OTOKITI.
OTOKITI. Okay. So, comprehensive management of sickle cell disorder. In layman terms, what does that, for the everyday person, what does that even mean?
Okay, before I start, I'll just briefly introduce what sickle cell is.
Mm-hmm.
I'm sure many of us have heard about sickle cell and know what sickle cell is. Okay, so sickle cell anemia means that an individual has inherited a sickle cell gene from both parents, like the mother and the father, making that individual an SS. There are other combinations of sickle cell disease, the SC, the S beta thalassemia, SD, and SO, like that. Okay, but the most clinically relevant combination is the sickle cell anemia, and it's also the most clinically important combination. That's why most of the time we talk about sickle cell anemia. Now, when we're talking about comprehensive management of sickle cell anemia, it just shows to say that managing sickle cell anemia is a multifaceted, multidisciplinary approach if you want to adequately manage sickle cell anemia.
Yeah, so if we're going to explain comprehensive to the everyday person, that would be the entirety, managing sickle cell completely, everything that comes with it. Right.
Yes. Okay, so before I go ahead, I just want to ask, and this question also goes to me and other doctors, healthcare givers, as well as parents and carers of individuals with sickle cell. How often do we ask them, are you happy? How has this disease affected you? How is work? Are you depressed? Are your grades doing fine? Is there something you want to, are you able to talk to anybody? Do you want to talk to me about something? Because most of the time we are sort of overwhelmed with seeing that person as just, okay, this is an individual with sickle cell anemia, forgetting that this individual has a life beyond sickle cell anemia. It has emotions, is either working, is going to school, he or she has a love life also. So it's important that we look at this in totality in managing individuals with sickle cell anemia.
Right, okay. So what you're saying, the first step is recognizing that these people have other things going on with their lives, not just this illness.
Yes.
And then addressing them directly, or trying to take care of them based on what you know about them as a complete person.
Yes.
Okay.
Yes.
Okay, so for example,
for example, when we're talking about comprehensive management of sickle cell, I like to take them stepwise so that everyone can follow. We want to the goal is that we want to, as much as possible, reduce the burden of sickle cell in the population, and that starts from prevention and newborn or neonatal screening. So as much as possible, it's imperative that as a parent or a caregiver, if you have reason to suspect that your child might have sickle cell anemia, or your child is at risk, maybe you've had previous children with sickle cell anemia, you have to screen the newborn to detect if this new child or this newborn has sickle cell anemia. And also you want to cater nutrition wise. This is a kind of child that as much as possible you want to give exclusive breastfeeding to them. It's not a child you want to start giving formula feeds, goat milk and all that. And even after 6 months, you want to fortify pap. You can't afford to just give pap alone. You want to fortify the pap with crayfish, soybeans, fish, prawns, egg, milk, and what have you. Also immunization and vaccination, very, very important. Now, immunization and vaccination are rights for every child,
of course,
but in sickle cell, in children with sickle cell anemia, it's even more important because unlike other children with that sickle cell anemia, they are not able to mount adequate response to infection. And this is because most of the time there's an organ called the spleen, which functions to produce antibodies against infection. In sickle cell anemia, these children or individuals with sickle cell anemia, they don't have a spleen. So response to infection is really compromised and very low. So as much as possible, you want to cover them with immunization and vaccinations, and that might go beyond the immunizations covered by the government in the National Program for Immunization, Extended Program for Immunization. You might have to pay out of pocket to source for this immunization, but your child will be better off, because you don't want this child to come down with severe infection, because this child won't be able to mount the same response as
other children.
Yes, as other children. Yes. Okay. So that's very important.
Right. So even with the vaccines, because you know some people are skeptical about them. Oh, with the vaccine you could get the disease that you're getting the vaccine for, things like that. So how do we have that conversation and debunk that notion? Because really, vaccines are do or die for the average child, but most especially children who, as you said, have sickle cell anemia, because their immune system, in a sense, is compromised, or the infection fighting aspect of their body is compromised.
Yes.
So how do we debunk that?
Okay, most of the time, what we'll tell them that when you're getting immunized, you're either getting a dead form of the microorganism that we're protecting against. So it's highly unlikely. Then when individuals were getting infections from query immunization, that was when it was a form of life attenuated form. Okay, so the microorganism is still alive, but it's so weak. But now most of the time they are killed, they are purified, so it's absolutely unlikely to develop infections from immunization. And the benefits outweighs the risk 101%. Yes, exactly. Okay, so other forms include advising them to take fluid adequately. So most of the time we tell them target about 3 liters per day. It's very difficult, well, especially when you're not a water person. Exactly, but you are better off it, because as much as possible when you drink water, you are hydrated, your red cells are hydrated, and as much as hydrated your red cells are, it's less likely for them to sickle. So it's less likely for that individual to come down with complications from sickle cell. So, and also what we also do in comprehensive management of sickle cell is that we'll, as much as possible, we'll give them prophylaxis against malaria. Yes, in this part of the world, malaria is endemic. I mean, if you check almost everybody, you find a certain level of malaria parasites in us. But as I said earlier on, because of this lower ability to fight infections, we, as much as possible, will give them prophylaxis. So simply using proguanil a day can prevent them from coming down with life-threatening malaria infections. Then also pain control. Now this is a very important and crucial aspect in managing sickle cell. In sickle cell anemia, their life is usually punctuated by painful crises. And like I always say, pain is not something anybody should live with. Yes, and it's been postulated that pain from sickle cell anemia is probably the 3rd worst pain that can happen, coming after labor. God bless all mothers and potential mothers, and then toothache. So imagine having to live with toothache every day. Yeah, that's not a good way to live, right? Yes, so as much as possible, we always try to manage pain control in sickle cell anemia. And it's very important, once you are able to adequately control pain in an individual with sickle cell, you restore confidence in that individual. That individual will trust you as a healthcare provider, whosoever, you're a doctor, a nurse, or whatever. And then it's less likely that this individual will go outside to source for help. Now, if an individual with sickle cell anemia has a life of pain, person will most likely go outside and who can help me, and then probably goes to people, I don't know what they are called, shakope or so, that give them all cocktails of pain meds. Yes, the pain will come down, but is that a safe way to deal with the pain? No. And the next thing, the sickle cell patient comes out with kidney infection, kidney failure, liver failure, and all the likes. Yes. So the World Health Organization recommends that in dealing with pain in sickle cell anemia, you go for the top guys. We're talking about opioids like morphine, DF118, because they understand the severity of this pain.
Okay.
Yes.
So my question here is this: the morphines of the world, the other painkillers, that are even more intense than the Percocets and stuff. What about the risk of addiction?
Yes,
especially things like morphine.
Very good question. Now, drugs like morphine, copodamol, oxycodone, and the likes, they are prescription-only drugs.
Of course.
Yes. So, in ideal climes, no pharmacy should sell the drug without prescription. One, and even after dispensing the drug, that pharmacist should withhold that prescription so that that individual doesn't go to another pharmacy or come back with the same prescription to restock on his or her own without the doctor knowing. Now, what happens if you don't adequately control the pain? This patient will probably get another opioid that is not exactly prescription oriented and start abusing the drug. So if the patient is not the pain, why would the patient abuse?
True.
Yes,
that's true.
Yes, so very important. Okay, and so other things we also look at is doing a transcranial Doppler.
Okay.
Yes, which is like a scan, but on the head. We usually recommend this for individuals with sickle cell less than 15 years.
Okay.
Yes, 15 years of age. Because in sickle cell anemia, one of the most scary complications that can happen is a stroke.
Yes.
Yes, a stroke. So imagine a young child with a whole life ahead of him or her, or a very young, vibrant adult with a slight truncated acutely by a stroke, being paralyzed on one side or on all limbs. And transcranial Doppler will predict the risk of developing that stroke way before it even happens. So once an individual undergoes a transcranial Doppler ultrasound scan, which is available at the Sickle Cell Foundation, and they notice there's a very high risk of stroke, you can start transfusion, start hydroxyurea therapy or whatever drug that can be used to prevent this from happening. So you're really making a huge difference. As they say, early detection saves lives. And this is not just in cancer, it's in basically all medical conditions.
Illness,
yes, so preventing the stroke from happening goes a long way. And also, a lot of the time we fail to realize that these individuals may also have psychosocial issues. For example, we know many of the time a lot of families have been broken apart as a result of sickle cell, having children with sickle cell anemia. And you can imagine a child carrying that burden, carrying that guilt. Oh, mommy and daddy are no longer together because of me. Or, oh, mommy complains she doesn't have any money because she spends so much on me in the hospital and all that. So sometimes they might need a psychologist or a psychiatrist to talk to them and, give them some
encouragement, maybe, or give them tips on how to get through life.
Yes, exactly.
Okay, so we've spoken about the vaccine. We're now talking about the mental and emotional aspects. We're talking about the physical aspects. So preventing, there are things that we can do to prevent things like stroke and things of that nature. So then what's the other aspects of managing sickle cell? And then we also talked about the person holistically. Making sure that we can give them that specific kind of support and treatment needed based on who they are and what their interests are, what they do. So then what else? What else is important, or what are other important factors?
Yes, there are quite a number of them. So I'm just going to understand we have like 30 minutes.
Oh, yeah, let's just talk. Just lay it on us.
Okay. So also part of what we do is we give them what we call imatinib, a drug as simple as folic acid. Yes, folic acid, very cheap, can go a long way.
Wow.
In affecting how the sickle cell disease behaves in an individual. For example, a normal red blood cell survives for about 120 days, which is about 4 months, right? But in sickle cell anemia, this cell survives for maximum 20 days. So 10 to 20 days, that red cell is destroyed. Now, let's look at the bone marrow where these red cells come from as a manufacturing company. So a manufacturing company makes use of raw materials, right, to produce a product. So in the bone marrow makes use of vitamins like folic acids and the likes to make red blood cells.
Right.
So individuals with sickle cell, as a result of this increased destruction in the body, their bone marrow overworks. So yes, the bone marrow has to keep up with the rate of this destruction. So while a normal person will have a red cell surviving for 120 days, the bone marrow of individual with sickle cell anemia only survives for 20 days, and then this bone marrow has to keep up making a lot of red cells. Yes, because they are being destroyed. So giving folic acid is sort of like helping the bone marrow. Okay, I know you're doing a lot of work.
Right.
Yes, take folic acid to help in the process of making these red cells. The worst thing that can happen to an individual with sickle cell anemia is that there is no raw material to make the red cells. And remember, the red cells already produced are being destroyed at a very fast rate.
As is.
Yes, so what happens? Problem, double jeopardy.
All right, Lagos, we're talking comprehensive management of sickle cell disorder. We are with Dr. KEMI OTOKITI.
Yes.
I got it right this time.
Yes.
Senior Registrar from the Department of Haematology and Blood Transfusion, LUTH. We have a lot more to talk about, but we're going to go on a quick break, so please don't go anywhere. We'll be right back. OTOKITI, she's Senior Registrar, Department of Haematology and Blood Transfusion, LUTH. We've been talking about the comprehensive management of sickle cell disorder. So basically what that means is overall how to manage and take care of a person who has sickle cell. We've been speaking specifically in terms of sickle cell anemia, right?
Yes.
Okay. So, Dr. OTOKITI, tell us more. Do you prefer Dr. KEMI, Dr.
KEMI is fine.
Okay, Dr. KEMI, tell us more.
Okay, so part of what can also be done in the comprehensive management of individuals with sickle cell is the institution of hydroxycarbamide. It's a drug commonly goes by the name hydroxyurea or Hydra. Some individuals might be aware of this drug. Okay, so it's one of the few drugs that can help modify the way disease works, the way the disease acts or behaves, the way the disease behaves. What it does is that it increases the level of hemoglobin F, which is what we want. As much as possible, we want to reduce the level of hemoglobin S.
Okay.
And so, yes, that's the bad. Let's just call hemoglobin S the bad guy.
Okay.
Yes. So, with hydroxyurate or hydroxycarbamide, it increases the level of hemoglobin F, and hemoglobin F helps reduce the addition factors being expressed by the red cells. So what it means is that these red cells are less sticky than they usually are. They are less likely to sickle. They are less likely to get stuck in the microvasculature, in the blood vessels. Yes, less likely to cause a stroke, less likely to cause a kidney damage, less likely to cause liver damage. Also, what can be done is the use of what we call gene editing.
Okay.
Yes, those are the next phase of treatments in managing sickle cell anemia, because the plan is towards a cure, right? And because sickle cell anemia is a genetic disorder, so if we are able to target that abnormal gene, yes, a abnormal gene that codes for the HBS, and replace it or sort of edit it or engineer the gene to produce not HBS.
Okay.
That's a potential cure, right?
Right. So gene editing would take place when the baby's still in the womb?
No.
Or when the baby's born?
Yes, can be done when the baby is born.
Oh.
Yes.
Okay.
Yes.
Okay. And can that be done here in Nigeria? Has it been done yet?
No. It's not even been FDA approved in the US or in the world. But I'm just saying the future prospects.
Scientific, they're still going through
it's possible because the genetic disorder in sickle cell anemia is what we call a monogenetic disorder. It's just one gene that is affected. Unlike cancer, that many genes are affected and you can't, where do you start from? But in sickle cell anemia, it's just one gene. So you can go after the gene, that mutation, and correct it or engineer it. Yeah, maybe we can cure that person. Then there's bone marrow transplant too.
Okay.
Yes, bone marrow transplant. Yes. I can't but say that. So it's been on for a while. Yes, carries the potential of curing that individual. The person can revert to be an AS or an AA depending on the level of chimerism between or how well these I don't don't know how easy or how basic way to say it, level of chimerism between the donor cells and the recipient cell.
Okay.
Yeah, so imagine all we are targeting is the 30% A in that individual, and all the symptoms of HBS will be ameliorated, like gone. Yes, yeah. And they're also targeted therapy that can, we call them targeted therapy because these are like monoclonal antibodies. They are the future.
Right.
Yes, they are the future of sickle cell management, and all we're trying to make that individual as disease free as possible to live normal life. Yes, that's what we want. I mean, the patient is better off, the doctor too is better off, right?
True.
Yeah, so with targeted therapy we can target all the molecular basis of the way the sickle cell anemia behaves, and make the red cells less sticky, make the blood vessels also less sticky too.
Right. Okay.
Yes.
So, these treatments and research, etc., they can all be done from a patient as young as?
Yeah, for example, for bone marrow transplant, usually want still a child, maybe 10 years, 15 years, thereabout.
Okay.
Yes,
Good.
yes,
All right.
yes.
Okay, Lagos. Well, there you have it. Thank you so much, Dr. KEMI, for joining us. Thank you for shedding light. And I think it puts into perspective the fact that sickle cell patients are everyday people just like you and I.
Exactly.
Okay, so guys, that is Surviving Sickle Cell. And it's brought to you in partnership with the Sickle Cell Foundation Nigeria and in honor of our beloved Tosin Bucknor. Thank you guys so much for tuning in. We'll do this next week.